Are you on TRT and worried about your fertility? Maybe you already started testosterone replacement therapy and now you're thinking your fertility is going down the drains and you want to see what you can do to preserve your fertility. My name is Dr. Terranella, and in this video, we're going to look at this specific question, how to preserve spermatogenesis and fertility while you're on TRT. Again, my name is Dr. Terranella, and if you're new to this channel, I just want you to know that I make these videos to help you go beyond the basics of your health. If it's confusing lab tests, symptom, or just trying to figure out something like TRT and fertility. So if you like this kind of information on nutrition, hormone optimization, etc., click on the like button and don't forget to subscribe to the channel to get more videos like this one. Now for a quick disclaimer. All right, let's look at TRT and fertility. So in this video, we're going to look at TRT and fertility, specifically how to preserve spermatogenesis while you're on TRT. We're going to look at some of the research behind preserving spermatogenesis during TRT or testosterone replacement therapy. So for those that don't know, testosterone replacement therapy will lead to a reduced production of something known as LH and FSH. These both come from the pituitary in the brain, and they stimulate the testes to do one of two things. The LH stimulates testosterone production from the Leydig cells, and the FSH stimulates production of spermatozoa in the Sertoli cells. The testosterone and then the corresponding estrogen then feed back to the brain and reduce the output of FSH and LH. So as a result, TRT, testosterone replacement therapy, reduces the production of those and then the spermatogenesis. So that's why when you're taking TRT, a lot of times the testicles will shrink because they're not getting that stimulation from the brain from those two hormones. Not only are you getting reduced spermatogenesis, you're also getting reduced testosterone production in the testes directly. So you have plenty of testosterone in your body, but there's not a lot being produced in the testicles themselves. Depending on your dose and starting level of spermatogenesis or sperm production, most will have no sperm, zero sperm, within about 10 weeks of being on TRT. More alarming or possibly more concerning is that somewhere around 10% will remain this way even after stopping testosterone replacement therapy. So what do you do if you want both testosterone replacement therapy and fertility? That's where HCG comes in. HCG therapy can help preserve spermatogenesis during TRT therapy, and it's thought to do this in part by preserving the intratesticular testosterone production. That's one of the things that it does, but it also stimulates the Sertoli cells to produce sperm. So HCG works as a mimetic or an analog to FSH and LH, and it can stimulate both sides of this. It can stimulate the Leydig cells to produce testosterone and the Sertoli cells to produce spermatozoa. Stimulating Sertoli cells with FSH only will not actually initiate spermatogenesis in someone that's hypogonadal or that has low testosterone. And this led to the discovery of the importance of intratesticular testosterone production in the process of spermatogenesis. And I'll have a link to some of the research behind this video in the description. So a small study looked at hypogonadotropic hypogonadal men, which basically means they weren't producing a lot of LH and FSH, and they also had low testosterone at the gonad level. There was not a lot going on there. And it looked at the ability of HCG plus testosterone to induce spermatogenesis after 24 months versus FSH and testosterone after 24 months. The study found that HCG plus testosterone was able to induce spermatogenesis, and the FSH plus testosterone was not able to do this, which is pretty interesting because FSH is directly stimulating those Sertoli cells where the sperm come from. And as we said, HCG is an analog or mimetic to both FSH and LH. So the LH stimulates the testes to make testosterone. The long and short of the study is basically that having some sort of LH mimetic is just as important as having a FSH mimetic, and that testosterone itself is a vital part of spermatogenesis, but it has to be produced locally in the testes. So what does this mean for you in terms of TRT and maintaining your fertility and how not to lose your spermatogenesis during your testosterone replacement therapy? So basically, if you're on testosterone replacement and wanting to conceive, HCG is definitely going to be a must for you. After several months on HCG, you might want to do a semen analysis. If you haven't started testosterone replacement therapy, you may want to do one before just so you have a baseline. But if you're already on it, you definitely want to see where you're at, get a baseline, and then get on HCG. And whether it's low at baseline or not, it's still important to go on HCG in order to preserve the spermatogenesis process. The semen analysis is just basically helping you calibrate how much HCG you need. Dosing on the HCG can vary a lot on whether or not you're trying to preserve the function there or actively trying to conceive, with levels ranging somewhere between 500 IUs per week to 4,000 IUs per week. Sometimes it would make sense to also take a month or two off every 6 or 12 months, especially in the case that the semen analysis is not looking very good or you're not preserving that function very well. Sometimes clomiphene or enclomiphene can be used, but its result is going to be much more limited if you're still on testosterone replacement therapy. If you're going off of it, then that's where those things can be much more helpful. Of course, the approach that you take, the dose that you take, etc., should be tailored to your unique needs and actual lab result numbers. What you do is going to depend on how close you are to actually trying to have a child and how important this is to you. And of course, you always want to get advice from your doctor that knows and understands your unique situation. All right, how'd I do? Did that help you better understand TRT and fertility, in particular, how to not have low sperm count? Hopefully it does. If you do have questions on this topic, get a lot of questions on this in general, drop them in the comment section. Happy to try and answer your question. Thanks again for watching. We'll see you next time.